Good evening, everyone. Okay, so let me introduce my study on effects of diabetes on pregnancy and its awareness among antenatal mothers. In summary, the study shows miscarriage is one of the main complications of uncontrolled diabetes on pregnancy. It can also result in other complications like stillbirth, preeclampsia, and high rate for cesarean delivery. When there is history of GDM in one pregnancy, there is more chance to recur it in subsequent pregnancies. Also more likely to develop type 2 diabetes later in life. So what? Diabetes complicating pregnancy is becoming more common worldwide. The prevalence of hyperglycemia in pregnancy increases rapidly with age and is highest in women over the age of 45. Gestational diabetes accounts for 90% of cases of diabetes mellitus in pregnancy, while pre-existing type 2 diabetes accounts for 8% of such cases. 1 in 7 births is affected by gestational diabetes. There is a strong relationship between the level of glycemic control and a number of adverse outcomes in pregnancy. Any unmanaged hyperglycemia in pregnancy can result in complications such as recurrent miscarriages, preeclampsia, cesarean section due to fetal macrosomia and CPD, polyhydramnios, stillbirth, type 2 diabetes later in life, and recurrence of GDM in subsequent pregnancies. The background of my study is there is a strong relationship between glycemic control and a number of adverse outcomes in pregnancy. For this reason, along with the opportunity to prepare for pregnancy and ensure optimal maternal health before pregnancy, it is recommended that all women with diabetes plan pregnancies and for counseling before pregnancy consider glycemic control and other risk factors. There are numerous observational series which have demonstrated that women who attend pre-pregnancy counseling have lower maternal HbA1c, higher uptake of folic acid, and lower rates of smoking. While some of these differences will be accounted for by self-selection of women to pre-pregnancy counseling services should be designed to try to encourage counseling before pregnancy. At a practical level, there are a number of potential barriers to this. Pregnancy planning will require adequate access to contraceptive advice or decide. There may be barriers to pre-pregnancy advice based on ethnicity or social exclusion, and services need to be responsive to this. An increasing issue in many countries is pre-pregnancy management of women with type 2 diabetes. In several countries, women with type 2 diabetes of childbearing years may be more likely to be from ethnic minorities with potential language barriers to access to pre-pregnancy care. More generally, women with type 2 diabetes may be more likely to be already treated with antihypertensive as well as oral or injected hypoglycemic agents not suitable to pregnancy. Adequate pre-pregnancy counseling is more urgent in these women. About the methods used, the study was conducted in a maternity hospital. 100 antenatal mothers admitted with diabetes complicating pregnancy were selected for case study. The data was collected by interviewing them based on a questionnaire which comprised demographic data, family history, past obstetric history, and past medical history. The selected mothers were from India, Pakistan, and other Middle East countries. All of them were very cooperative for the study and participated well. The result of the study shows among 100 antenatal mothers with diabetes complicating pregnancy, 90% were with GDM and 10% with type 2 diabetes. Out of these, 40% were on diet control and 60% on medications like oral hypoglycemic and insulin. 38% women had miscarriages, 8% with preeclampsia, 50% with recurrent GDM in subsequent pregnancies, 10% developed type 2 diabetes within 5 years, 4% had stillbirth, 20% delivered through cesarean section. And among all these, only 10% of them is aware of the complications of diabetes in pregnancy. So let me conclude my topic by mentioning few points. Miscarriage is one of the common complications identified, and it is mainly due to lack of awareness about diabetes and its effect on pregnancy. Half of women had GDM in subsequent pregnancies, with those with type 1 and type 2 diabetes need a proper pre-pregnancy counseling, and those with gestational diabetes should go a strict lifestyle modifications to maintain blood sugar under control. Women who have any of the risk factors for diabetes have to undergo an early screening for diabetes from the first antenatal appointment. The study shows that through a proper awareness program, most of the adverse effects of diabetes on pregnancy can be avoided. And in my future step is I need to conduct more studies on measures to control and prevent diabetes in pregnancy. Thank you everyone.